morning, and thank you for joining me. I'm Dr. Ashley Merrifield, audiologist in the Bethel Park area. Today we are going to be talking about hearing and your health. But to get us started, I thought we would take a moment just to talk about what an audiologist is for those who may not know. An audiologist is a healthcare professional who specializes in the evaluation, diagnosis, management of hearing loss and balance disorders, as well as other related auditory disorders. To help us understand hearing loss a little bit better, we'll start with talking about the ear and how the ear works. So when we talk about the ear, we typically discuss the ear in three main parts: the outer ear, the middle ear, and the inner ear. The outer ear starts with the cartilaginous flap that we see here, so the piece of the ear that we see on the side of our head, and it has various ridges and depressions. This is called the pinna or the auricle, and its job is to help collect sound and help funnel that sound down through the external auditory canal or the ear canal. Once that sound travels down the ear canal, it bounces off the tympanic membrane, or what we more commonly call it, the eardrum. The eardrum is just a very, very thin piece of skin, and once that sound bounces off the eardrum, it sets the eardrum into vibration, which brings us to the next part, our middle ear. Our middle ear is an enclosed cavity of space that actually comprises what we call the ossicular chain, or three teeny tiny bones called the ossicles. Those are located right up here on this poster. So the ossicles, they're the malleus, incus, and stapes, or if you remember learning in school, the hammer, the anvil, and the stirrup. The stapes, or the stirrup, which we learned in school, is actually the tiniest bone in our body. The malleus is connected to the eardrum at one end, and the stapes is connected to what we call the oval window, which is an opening into the third part of our ear called the inner ear. And then the incus is connected in the middle to both the malleus and the stapes. So when that sound bounces off of the eardrum, setting it into vibration, that vibratory energy is transmitted across that middle ear space to our inner ear, which is all of this good stuff right here. Today, what we're mainly going to be focusing on is this coiled up structure right here called the cochlea, which is a fluid-filled chamber. Okay, so there are three chambers inside here, each of which are fluid-filled. So when that stapes, or that stirrup, that tiniest bone, is vibrating, it's actually pivoting in and out of that oval window, causing disturbance of the fluid inside our inner ear, which later leads to stimulation of our sensory cells called hair cells. Now, stimulation of those hair cells eventually lead to electrical signals being created that are then sent to the brain via the auditory nerve, and our brain is then able to interpret what sound we are hearing. So when I talk to my patients, I tell them that our ear is sort of like a microphone. It's picking sound up in the environment and turning it into a signal that can be later interpreted by our brain as the sounds that we hear, such as the telephone ringing, the dog barking, or being able to understand our loved one at home. So now that we understand a little bit more about our ear and how hearing works, let's talk about hearing loss. Hearing loss is the third most chronic condition in the United States. It's surpassed only by hypertension and arthritis, and it affects currently about 36 million Americans. According to the American Academy of Audiology, you can also think of it about 1 in 3 people over the age of 60 has hearing loss, while 1 in 2 people over the age of 85 have hearing loss. Typically, a hearing loss is a result of multiple factors. Some of those factors can include a family history, so we have a hereditary component to our hearing loss, noise exposure, lifestyle choices, as well as various medical conditions and medical treatments. Hearing loss can also be caused by age-related changes to the structures of the inner ear, blood flow to the inner ear, the hearing nerve, as well as how the brain processes speech sounds. These age-related changes that result in hearing loss is called presbycusis, and a presbycusis can be worsened by the other types of factors that we talked about, such as medical conditions. Some of the medical conditions associated with an increased chance of hearing loss are diabetes, chronic kidney disease, cardiovascular disease. Individuals with those medical conditions are at increased risk to develop hearing loss than those without. So why do we care if we have hearing loss or not? Well, untreated hearing loss has been associated with an increased risk of depression. Untreated hearing loss can cause decreases in our physical, emotional, and mental well-being. People tend to withdraw because they're unable to communicate effectively with their friends and family. We also talk about it in terms of the use it or lose it principle, basically meaning that our brain's ability to be able to process and understand speech can decline over time if we have untreated hearing loss. One way that we can treat hearing loss effectively is through the use of hearing aids. Hearing aids are essentially microcomputers that process sound thousands of times throughout the day to make sure that we're hearing the sounds the best way that we can. And using hearing aids improves our quality of life by making communication with our friends and family better and easier. Hearing aids come in a variety of styles. We have one style which is called the in-the-ear hearing aid. This is actually a completely in the canal, so you can see that it's customly made to fit this model ear and sits deep down into the canal. While we also have various styles of behind-the-ear hearing aids. Most people can find improved quality of life through the use of hearing aids, and most hearing losses can be treated effectively through the use of hearing aids. Although hearing loss is inevitable, there are a lot of things that we can do to kind of help prevent our hearing loss from progressing more or for progressing or onsetting sooner than expected. One of the best ways to do that is always protect your ears when you're around any type of loud noise. So anytime you're around loud noise such as carpentry tools, farm equipment, lawnmowers, always make sure that you're using appropriate ear protection and always try to make good lifestyle choices. All right, so that's it for me. I hope you enjoyed this presentation and learned a little bit about hearing and your health. So if you or someone you know feels like they're having difficulty hearing or not able to communicate with your family the best way that you want to, contact your primary care physician or find a local audiologist and ask about getting your hearing tested. Thanks, have a great day.
Good morning or good afternoon. Not sure what time of the day this is going to be aired. My name is Frank Velasquez. I'm the Director of Sports Performance for the Allegheny Health Network, Sports Performance and Physical Therapy. Today we're going to be discussing concussion education, okay, a very hot topic nowadays that's being diagnosed more. Find out what a concussion is, some of the signs and symptoms, a plan of action when one does happen, and then how do we get our athletes or our adults back to game status, game speed, or full status, back to return to play. Whenever I go to presentations, I always like to know who I'm talking, who I'm listening to. So again, my name is Frank Velasquez. I'm an athletic trainer and strength conditioning specialist. I have over 23 years of experience in the field working with elite level athletes, professional and Division I college. and for the last 5 years I've been in the business world as an entrepreneur and now on with AHN. So I've worked with athletes from 7, 8, 9, 10-year-olds up until our elderly statesmen that are active adults and 75, 80-year-old athletes. Came on with AHN February 2016. We have a great staff, professional staff. We have the premier strength and conditioning sports performance facility in the Pittsburgh area, Western PA for sure. 2 facilities, one in Bethel Park, Cool Springs, our Cool Springs location, and then one also in the North Hills in Wexford. Also, I can't forget the 9 of my 16 years in professional baseball were spent with the Pittsburgh Pirates as their Major League strength and conditioning coach. AHN Sports Performance, a little bit about us. We have an orthopedic institute. We have physical therapy. Our physical therapists have direct access licensure, which means you don't need a physician's referral to see our physical therapist. You can come right in and we can do the evaluation under your health insurance, and then if we felt like you needed to see a physician, then we would get you triage that and get you into our physician as swiftly as possible. And we can treat you for up to 30 days without that prescription. If we're still working on you after 30 days, then we would go ahead and get a prescription. We do our strength training, anaerobic conditioning, speed, agility, power development, all that comes with sports performance. Also bringing on therapeutic massage coming soon. We do have a sports nutritionist or a sports dietitian on staff. We have a cryotherapy chamber for recovery and rejuvenation. We do concussion baseline testing, rehab, and also return to play programs and athletic taping services. We educate our clients. We help our clients reach their goals, whatever they may be. We create durable bodies. Our programs are designed to reduce the risk for injury and to enhance performance. So getting into our concussions, basically TBI is a traumatic brain injury, also known as a concussion. Again, very hot topic. They're diagnosed more and more. We need to have a plan and a process when one does happen. What does the parent or what does the coach do? And then we're going to talk about some of the facts. Actually, we're going to start out with the facts. You can see over the past 9 years, they've been diagnosed more. There's over 300,000 more concussions diagnosed from 2001 to 2010. The CDC estimates that 1.6 to 3.8 million concussions occur a year. Okay, that's a lot of concussions, a lot of blows to the head. The fact that really sticks out to me on this page is the one highlighted in yellow, that 47% of athletes do not even report feeling symptoms when they get concussed the day of the concussion. They occur afterwards. So that's the scary part. We get banged in the head, we think everything's fine, we continue to play, and it's the day or two after when we start to see and feel those symptoms from the concussion. What is a concussion? Okay, a concussion this is per Webster's Dictionary, any type of traumatic brain injury or caused by TBI, caused by a bump, blow, or jolt to the head, or by a hit to the body that causes the head and brain to move quickly back and forth. Okay, this fast movement can cause the brain to bounce around and twist in the skull, creating chemical changes in the brain and sometimes stretching and damaging our brain cells. So anything from a blow to the head to just bumping your head on the wall is really considered a concussion, from obviously very mild to severe. We're talking whiplash or traumatic blows to the head, automobile accidents. There's a big spectrum of concussions that can be considered. Symptoms, okay, anything from a headache, I feel pressure in my head, to nausea and vomiting. Okay, again, there's a lot of symptoms that go. Balance or dizziness problems, double vision, trouble seeing, sensitivity to bright lights and loud noises, feeling sluggish, low energy, lazy, okay, having trouble concentrating or remembering your short-term memory, and just not feeling right. So these are all, there's many of them, but these are the main ones that we get when our clients see our doctors at AHN, Allegheny Health Network, some of the symptoms that they have. Now, signs, as a parent or a coach, I mean, you know your son or daughter the best, and the athletes know their the coaches know their athletes. So some of the things you look for, are they dazed or kind of stunned? Are they forgetting instruction more? The score of the game, who we're playing. Are they a little less coordinated, more clumsy than usual? If they answer your questions slowly, just running a tick slower than they usually react. Obviously, if they lost consciousness, that's something we want to be very aware of. Or if they're showing mood or behavior or personality changes, just more irritable or short-tempered. And they can't, if they have they lost their short-term recall, if they can't recall events prior to or after the hit or fall. These are all signs that we want to look for as a guardian or a coach or just a concerned parent, when dealing with concussions. Now, some of these other signs, a little more severe, okay, a little more medically picked up by our physicians and athletic trainers, is one pupil bigger than the other. Okay, your pupils are the dark parts of your eyes. They're supposed to be the same size, so if they're not, that's a sign of a concussion. Drowsiness, inability to wake up, just hard to wake up. Bad headache, migraine type, severe type headache. Slurred speech, okay, weakness, numbness, or decreased coordination. Weakness in the limbs, numbness in the hands, feet, or anywhere in the body, and just, again, that clumsy, inability to coordinate simple movements. If we're vomiting, the nauseous feeling, convulsions or seizures, obviously a very important and one end of the spectrum symptom, okay? And unusual behavior, increased confusion, restlessness, agitation, and then the telltale is that loss of consciousness and being passed out or knocked out. Okay, those are the most serious signs of concussions. Now, what do? We need to have a plan of action. Okay, we have a simple term that we talk about as athletic trainers and sports medicine specialists is when in doubt, sit them out. If we get a kid that got their bell rung, you saw it, or a teammate comes up and tells you, as the athletic trainer, get them out of the game. So remove from play. We're going to seek medical attention, okay, so they can go to a physician that can diagnose them with a concussion. We're not able to diagnose as athletic trainers and strength coaches or parents. You want to get it medically taken care of. We want to keep the athlete or the adult out until the symptoms that resolve, the symptoms we talked about, the vision, sensitivity to light and noise, the headaches. Those symptoms have to go away before we progress to the next step. We want to make sure we're communicating, okay, as guardians and parents, communicating with the coaches, communicating with the teachers, anyone that your child's going to come in contact with. You want to let them know, make them aware that, hey, little Frank was hit in the head. He suffered a concussion while playing in the basketball game last week, and we're recovering from that. So everyone needs to be on the same page and not have the same expectations as if nothing happened. We want to follow up with our physicians. Generally, our physicians will want to see our concussion patients or clients once a week on a regular basis to see that symptoms are resolving. Physical therapy may be prescribed. Okay, there are things we can do as physical therapists to help with vestibular rehab and soft tissue treatment to help enhance the recovery of a concussed athlete or person. And then also a return to play program. So the symptoms have resolved, the signs are gone, they're feeling better, and before we just cut them loose going back into full status, we need to take them through a battery of tests to almost try to reproduce the symptoms. Okay, there's something called post-concussion syndrome or second concussion syndrome, where if we get those athletes back too early and they get concussed again, the symptoms are tenfold, and they're really debilitating and could lead to long-term disability. So we want to make sure we do this right the first time. The symptoms need to be resolved, they need to be cleared by the physician, and then therapy is taken care of, and then we take our concussed athlete or client through a post-concussion physical exertion test, trying to see if we can get those symptoms to resurface. If not, then we clear them to go back into limited and eventually progressed into full-time activity, full status. How do we reduce the risk? Okay, how do we do the things on the front end to reduce the risk of a concussion happening? One is we want to get a baseline test. That's nice that every athlete, a lot of high schools do. There's a couple, 3 different products out there where we can get a baseline test. The one that we use with Allegheny Health Network is called the C3 Logix. It's the Cleveland Clinic Concussion Baseline Concussion Test. And it's very effective, and it gives us a thermometer on what the brain function is when we're normal. Okay, so that when something does happen down the road, we can have something to measure against. So if little Frank got concussed and he takes the C3 Logix, a day or 2 after he's concussed, takes the retest, we compare it to his baseline, he scores less, then we wait a few days, as symptoms resolve, he takes it again, we can measure it against what his normal brain function was prior to being concussed. So you want to get a baseline concussion test. Studies show that neck strength, or the girth of the neck and upper traps, help to reduce the risk of concussions. There aren't many studies out there, but there are some legitimate evidence-based research studies that show the girth of the neck, or the neck size, neck strength, the better, the bigger, the more strength we have in our neck to protect our head, helps to reduce the risk of concussion. So simple, there's some photos here of some of our strength coaches doing simple tests where we need very little equipment to increase the strength on all the 4 sides of our neck. Another thing that we preach with all of our athletes and clients is wellness. You know, our nutrition, hydration, and rest. 3 things that can make a difference in how our body functions. 3 things that can make a difference in your level of performance on any particular day. And 3 things that can really help reduce the risk of a concussion by staying properly fed, okay, eating breakfast and then frequently throughout the day, staying properly hydrated. Our brain is surrounded by fluid, and that fluid is made up of water. So when we're dehydrated, that fluid is down and there's a higher chance for that brain to shake from side to side. So staying properly hydrated, again, drinking in the morning and drinking throughout the day, early and often. We used to say that in baseball all the time. We want to score early and often, and that's how we want to eat, and that's how we want to drink, early and often, to make sure that our body is getting the nutrients and the fluids to function at optimal levels on a daily basis. And of course, our rest. Okay, sleep deprivation, when we're robbing our body of sleep, only trying to live on 4 to 6 hours every night, we don't react as fast, we don't think as clearly, we're irritable, our brain doesn't function as well. It's tired, it needs rest. It recovers, our body recovers while we're sleeping, so we want to make sure we're getting that 7, 8, 9, 10 hours a night on a regular basis. You know, we can survive on less, but again, to help reduce the risk, we want to make sure we're getting those hours in. Nutrition, hydration, and rest. And then another way we can reduce the risk is by wearing the proper equipment. Okay, wearing our helmets when we take a bike ride or when we skateboard. Making sure we're wearing our mouthpieces when we're in our contact sports of football and hockey and sometimes even basketball, baseball, and volleyball players are starting to wear mouthpieces. Okay, for dental, to protect your teeth, and also so we're not grinding or clinching down when we do get a blow to the head. So the proper equipment can really help reduce the risk, and making sure we're sized right, the proper sizes and fitting, and obviously the proper equipment for each sport. So our return to play, we talked about the symptoms resolved. We talked about the second impact syndrome, or the second concussion syndrome. Our post-concussion physical exertion test is generally 3 phases, and if you're in a high school that has an athletic trainer that covers the high school, most high schools do nowadays, it's usually a 3-phase or a 5-day process to get them from phase 1 through 2 and 3. Now that's fine, but if we have a lot of athletes that are in middle school and grade school that don't have these athletic trainers, so that's where you need to seek out a medical professional, an athletic trainer, a physical therapist, a strength and conditioning specialist that can help take you through this post-concussion exertion testing. Again, 3 phases. We don't advance to phase 2 unless phase 1 is completed asymptomatically. So if we do phase 1, We check in with the athlete that night, the next day, and then we would do phase 2 2 days later if they were asymptomatic. If they had a headache that night or just didn't feel right the next day, we would repeat phase 1 until we could do it without signs or symptoms, and then we would progress to phase 2 and then eventually to phase 3. We do record metrics, so we take heart rate measures, blood pressure, and then of course subjective symptoms while we're trying to get through these phases. And each phase is a little more challenging, a little more movement, a little more heart rate training, more sports-like. When you get to phase 3, it's very sport specific. So if we're dealing with volleyball, we're jumping up and down a lot. If we're a wrestler, we're on the mat doing things, just making it as sport specific as possible, trying to elicit symptoms. And if we can get through those 3 phases without symptoms, then we sign off. They go back to the doctor, their primary care physician, and get back into limited and eventually full activity. So in closing, okay, we want to educate you on the diagnosis of a concussion, okay, what it was. So education brings awareness. If we're aware, then we can pick up on these things. And I think as a society, we are becoming more and more aware. That's why there are so many more concussions being diagnosed, which is a good thing. Because back in the day, we weren't diagnosed. And we got our bell rung and just kind of waited for the symptoms to go away and went back into play. Sometimes that same day or sometimes the next day or 2 or the next game. Preparation. Okay, we got to prepare by doing our neck exercises, by wearing our equipment, by staying properly hydrated, fed, and getting our rest. We do these things to reduce the risk. Okay, we want to reduce the risk of these concussions, and that's how we do it. Okay, we want immediate action. We get concussed, we want immediate action. Go that night to the doctors. Might be the ER or the next day to your PCP. You want to get it medically attended to. Okay, we want to make sure we're following up. Just don't go once and forget about it. Follow through. Trust the process. There is a plan in place by most sports medicine facilities and athletic trainers. So follow the plan. Trust the process. Have patience. The best thing we can have for our young athletes and our adults that have been concussed is time. It takes time for these symptoms to resolve. We can do some things to help expedite it, but it's time is the biggest thing. And don't rob yourself of time. Don't try to get back sooner than your brain is ready, your body's ready to, just to get back into the next game. It's not worth it, okay? And you'd rather be out for a limited time than for, we're talking months or years or maybe forever. So we want to make sure we're taking the time for everything to heal up, and then before we return to play. And then always remember safety first. We're thinking big picture. We're thinking big picture. We know we want to win that championship this weekend, but I'd rather have a nice long life for the person who's been concussed. Whether they're young, middle-aged, or on their tail end, they're elderly. We want to make sure that quality of life is taken care of. That's why the brain and the heart, they're the most important organs we have, and we want to take good care of them by making sure we're doing things right. So I thank you very much for your time with this and listening. If you have questions, my email is here, the top one there, Frank Velasquez minus the Z at WPAHS.org, and also Frank Velasquez minus the Z at AHN.org. And you can visit our website at AHN.org/sportsperformance. Again, I thank you very much and have a good day.